Hello, and welcome to this podcast on heart health. These are the topics that will be covered in this podcast. First, we're going to look at what the heart is and what it does. Then move on to some of the different heart and blood vessel diseases that can be seen in adults, workplace issues that are associated with heart disease, and then finally finishing off with the prevention of heart disease and some support links at the end. So firstly, what is the heart? What exactly does it do? Essentially, the heart is a large pump that is found in the left side of the chest cavity. It's a muscle that's made up of 4 different chambers called the right atrium, which receives the deoxygenated blood from the body, the right ventricle, which receives the blood from the right atrium and pumps it to the lungs, the left atrium, which receives oxygenated blood, and finally the left ventricle, which receives blood from the left atrium and pumps it around the rest of the body. The heart also contains 4 valves, which are found at the entry and exits of the ventricles, which are the bigger of the chambers, and it's also made up of arteries and veins. Arteries are blood vessels that take the blood away from the heart to elsewhere in the body, and veins are also blood vessels, but they bring the blood back to the heart. The first condition we're going to look at is coronary heart disease, and this is also called ischemic heart disease. And this is a buildup of deposits or a blood clot in the lining of the arteries which supply the heart muscle, and it causes a restriction in the blood flow to the muscle. Around 2.3 million people in the UK are living with this disease, and it's most commonly found in smokers, those who are diabetic, have high blood pressure or high cholesterol, people who have a family history of the disease, especially under 60 years old, obesity, people who are of South Asian ethnicity, men are at a higher risk, and people who are older in age. The most common symptoms of coronary heart disease are chest pain and shortness of breath. However, it's possible for people with this condition to not experience any symptoms at all. This type of heart disease is the most common cause of death in the world, and there are 2 different things that can happen. A person could experience a complete blockage of the artery, and this is called myocardial infarction, or more commonly we hear it being called a heart attack. Around 70 people survive a heart attack, and it requires immediate medical attention. It's also possible to experience a partial blockage of the artery, and this is called angina. There are different options for treatment with this condition, and these include making lifestyle changes, taking medication, having an angioplasty, which is a procedure to clean out the internal pipework, and in more severe cases, bypass surgery may be necessary. Next, we have hypertension, which is more commonly known as high blood pressure. So, hypertension or high blood pressure is when the force placed on the walls of the blood vessels is more than normal, and this then causes the heart to have to work harder and puts a higher level of strain onto the blood vessels. Around 25% of adults in the UK will experience this, and it's the 3rd biggest risk for premature death in the UK, so it's something that shouldn't be ignored. When you're reading your blood pressure, you will see 2 numbers, for example 90/60. The first number in this example, 90, is called the systolic blood pressure, which is the pressure when the heart is pushing blood out through the body. And the second number in this example, 60, is called the diastolic blood pressure, and this is the pressure when the heart fills with blood between heartbeats. There are many different reasons someone could be at a higher risk of high blood pressure, and a few are family history, being overweight, high stress, and not being very active. There's also no symptoms associated with having high blood pressure, but it's a major risk factor in a number of different conditions such as heart disease, strokes, peripheral artery disease, kidney failure, heart failure, dementia, and vision loss or blindness. And the main types of treatment for this are making those lifestyle changes and medication. So it's important to check your blood pressure and to consult your GP if it's consistently higher than normal. Moving on, the next condition that we're going to look at is called peripheral vascular disease. The NHS describe peripheral vascular disease as being a build-up of fatty deposits in the arteries that restricts blood supply to the leg muscles. You might also hear this condition being referred to as PVD. This condition can cause a number of different symptoms such as pain in the calf when exercising or when resting, ulcers, infection or poor healing, gangrene, erectile dysfunction, vision loss or blindness, and kidney failure. However, in some cases it's possible that someone may not experience any symptoms at all. Pain with this condition can vary from mild to severe, but leg pain usually goes away within a few minutes once the person is resting. There are a range of treatment options that the GP might suggest with this condition. Some of these are making lifestyle changes, using specific medications, having an angioplasty, which is a medical procedure that cleans out the arteries, and in very severe cases, they may need to perform bypass surgery or amputation. Of the 200 million people that this condition can affect worldwide, 20% of these patients will also suffer from diabetes, and around 20% of cases are seen in people aged 70 and above. Next, we have congenital heart disease, or CHD, and this is when there is a defect in the heart that develops before birth, for example, a hole in the heart. In most cases, it's not known why these defects occur, but a few different causes are genetics, if the mother had an illness during pregnancy, and if the mother was taking certain medications, using recreational drugs, or consuming alcohol during pregnancy. During adulthood, this condition can have a number of different effects depending on the specific issue with the heart. Some adults will experience no symptoms at all, while others could experience an impact on safety to become pregnant or an impact on safety when taking part in certain exercises and sports. Treatment for each person will highly depend on the specific defect that they have, but most commonly the options are either surgery or medication. There are a few conditions that don't actually require any treatment at all, and in some cases will correct themselves over time. If surgery is needed for a condition, it usually happens in childhood, and sometimes it can require multiple operations to correct the issue. And the medications can be used either on their own or in preparation for an operation. The next condition is heart failure, which can either be called acute or chronic depending on how suddenly it has happened. Acute heart failure is when someone gets unwell very quickly, and chronic heart failure means the person has experienced symptoms for a longer period of time. Heart failure means that the heart pump isn't functioning as well as it should do. Often when people hear this term, they can think their heart has stopped or could stop at any second, and this isn't the case. According to the British Heart Foundation, it's estimated that roughly over 1 million people in the UK have heart failure, with around 200 new diagnoses every year. There are different groups that heart failure can be classified into. The first is when less than 40% of blood is being pumped out, and this is called heart failure with reduced ejection fraction. Next is when 41 to 49% of blood is pumped out. This is called heart failure with minimally reduced ejection fraction. And finally, if more than 50% of blood is pumped out, this is called heart failure with preserved ejection fraction. The symptoms that can be experienced by someone with this condition are feeling breathless, experiencing fluid retention or swelling of the ankles, feeling tired and having spells of dizziness or fainting. A few of the different things that can cause someone to have heart failure are having a complication with a different heart condition, such as coronary heart disease, heart rhythm disturbances, heart valve disease, high blood pressure, heart muscle disease, and congenital heart disease. Aside from having an additional heart condition, this can also be caused by some medications that can damage the heart muscle, alcohol usage, and drug usage. If you go to your GP with symptoms that are consistent with heart failure, they may conduct further testing such as an electrocardiogram or ECG and refer you to a specialist heart failure clinic. There are several different things you can do to help with symptoms of heart failure, such as maintaining a healthy weight to reduce the stress on the heart, don't smoke, regularly exercise, limit alcohol intake. And there are medications that can be prescribed to treat this condition, and of course surgery if necessary. Now we've covered some of the common conditions, we're going to look at the connection between some of these with the workplace. There are some common things in a workplace that can actually increase someone's risk of coronary artery disease. Firstly is being exposed to extreme heat or extreme cold, inhaling tobacco smoke, working in a shift pattern which has been found to increase the risk by 40%, over-exercising or not exercising enough, occupational stress, and also exposure to noise. There was some research published in December 2023 by Environmental Health Perspectives, where Harvard did some analysis where they evaluated 3 decades of data from 114,116 women enrolled in the Nurses' Health Study. Using a geospatial noise model created by the National Park Service, which estimates noise levels in various locations using data gathered from monitoring sites across the United States, researchers assessed the connection between noise levels where participants lived and their incidence of cardiovascular disease. This research found that the more transportation noise participants were exposed to long term, the higher their cardiovascular disease risk. Each 4 decibel increase in noise over a baseline level was associated with about a 4% increase in cardiovascular problems, such as coronary artery disease and strokes. Earlier studies also linked noise exposure to short-term changes in circulation, including blood pressure, heart rate, and blood vessel narrowing. Study authors said, "These are all things employers should take into consideration when looking at employee health and well-being." Aside from the general issues in the workplace that can increase heart risks, there are some very specific things that will increase someone's risk of coronary artery disease. Exposure to carbon disulfide can increase risk, which is often used in manufacturing processes and is also found in cigarette smoke. Nitroglycerin is another risk that's used in manufacturing explosives, in mining, quarrying, construction, demolition, and pharmaceutical manufacturing. Carbon monoxide is found in manufacturing situations, in vehicle repair, when using any petrol or diesel powered equipment, gas appliances, welding equipment, etc. And methylene chloride is found in paint stripper. These are just a few examples of issues that can be found in very common workplaces, and it's understanding these small things that can make a difference when protecting yourself and your employees. These are a few simple but important things that can be done in the workplace to help improve employee health and reduce risks. Doing regular risk assessments is key. They should be in place to assess all risks in the workplace so that proper plans and provisions can be put into place to improve safety and well-being. It's also important to have regular reviews so that any changes can be monitored to see what's working and what isn't, so constant improvements can be made. Put no smoking policies in place to reduce smoke exposure and encourage employees to take breaks from their desk and increase their movement throughout the day, especially for those who have solely desk-based roles. This is not only good for improving heart health, but also for posture and mental well-being. Finally, we have some tips on things you can do as an individual to help prevent or reduce the risk of heart conditions. First is to stop smoking, and the effects on the body when you decide to quit start to happen almost instantly. Make sure you're getting enough exercise. The NHS recommends 150 minutes of moderate activity per week or 75 minutes of vigorous activity, and this helps with both physical and mental health. Maintain a healthy weight by making more conscious decisions about what you're eating, having a balanced diet that includes good amounts of carbohydrates, fats and proteins, reduce your salt intake, and lastly, reduce your alcohol consumption. These are some websites that you might find useful, which each have information on heart conditions and heart health. First is the NHS website, which takes you to the information page for an NHS health check, which is a free service to check your overall health and give you an indication if you're at a higher risk of some conditions like heart disease, diabetes, kidney stones and strokes. Next is the website for cardiac screening, the patient info website, which is an amazing source of information, British Heart Foundation, and the final NHS link is to some support for those living with heart failure. That is the end of this podcast. Thank you for listening.